Our next speaker is Dr. Matt Masters. Dr. Masters is board certified in addiction medicine and internal medicine. He's been in the full-time practice of addiction medicine since 2009 and has served as a faculty member of the Texas A&M School of Medicine in Round Rock, teaching in the psychiatry department. He's a member of the Physicians Health and Rehabilitation Committee of the Travis County Medical Society, where he has provided me with much needed adult supervision, wisdom, and practical advice as we help our colleagues navigate their recovery. He was medical director of a methadone clinic for 6 years and served as an inpatient rehabilitation attending for 5 years. He is currently in solo practice doing business as Austin Addiction Medicine Associates. And we have given Matt a technology workout this morning that I think he was patient enough to get through with us. So Matt, I always look forward to hearing and learning something from you, and I'm sure this morning will be no different. Thanks for being with us.
Thank you so much for inviting me. I really appreciate it, Brian. Can you hear me? Okay, great. Yeah, this morning has indeed been a technology workout, but I'm going to go with Dr. Tomlinson's recommendation about progress and not perfection. And so we're going to talk this morning about the diagnosis and treatment of the addicted physician. I'm attempting to advance the slide now. There we go. So first of all, I'm going to give an introduction about the direction of the talk. And first of all, we're going to look at some definitions of addiction. We're going to look into the social and cultural context of addiction in America. We'll look at the root causes of addiction, also known as the Big Five. We're going to study the neurobiology of addiction, and then we'll look at how to recognize the problem in the physician population, and finally the treatment. And interestingly enough, this morning's seminar is mainly focused on spiritual renewal. And the interesting thing about addiction is that it's one of the few areas of medicine in which a spiritual awakening is an indicated form of treatment. And so I'm going to talk about how that spiritual awakening occurs as the byproduct of working a 12-step program. And that'll actually be the bulk of the talk. I think you have to understand, though, that pain is the touchstone of spiritual experience. And I'm indebted to Dr. Spear for the 2 minutes of meditation this morning, during which time I said the Serenity Prayer over and over regarding the internet connection at my office. So behind me, you see my apartment. At any rate, we'll move into talking about definitions. The French philosopher Voltaire once said that if you would speak with me, you must first define your terms. And my favorite definition of addiction comes from John Bradshaw, who said that addiction is a pathologic relationship to a mood-altering substance, behavior, emotion, or relationship which results in life-damaging consequences. Additionally, scientific advancements in the study of addiction have highlighted the underlying neurobiology, and this has proved very important. We can now view addiction as a disease process, and I will discuss a little bit more about that later. But first, I want to deal with some of the societal stereotypes that surround addiction. As has been mentioned earlier, We sort of live in the society of John Wayne, where everybody is supposed to be rough, tough, individualistic, and pull themselves up by their bootstraps. And there are 4 diseases that you do not want to have in American society: anxiety, depression, or its cousin bipolar, alcoholism, or drug addiction. Because if you got any of those, you got a weakness of character, an inability to deal with life, a case of chronic wimphood, or worse yet, a moral failing. And who in their right mind would want to have any of those? Hence, all of the denial that surrounds the disease of addiction and the disease of psychiatric disorders. But John Wayne, the actor, and John Wayne, the individual, are 2 entirely different things. John Wayne, the individual, was a person named Marion Robert Morrison, and he was a stone alcoholic, okay? He drank a 1/5 of commemorative tequila every day by 5 p.m. and up to a liter of brandy at night. So not even John Wayne is John Wayne, okay? When I talk to the medical students at Texas A&M School of Medicine in Round Rock, I tell them that if I were going to synthesize an addict in the laboratory, I would need 5 things: genetic predisposition, dysfunctional family of origin, early childhood physical or sexual abuse, concurrent psychiatric disorder, and access to booze and drugs. In my experience, when you have all 5 of those, it is uncommon, bordering on rare, that you don't become alcoholic or addict. We know from studying the genetics of alcoholism, for instance, that 60% of alcoholics are genetic alcoholics. The other 40% drink themselves into the illness. We also know that people who grow up in alcoholic families or in families where you have severe psychiatric disease or drug addiction, that the chances of those children becoming alcoholic or addict is 25% higher than in the normal population. Early childhood physical or sexual abuse also contributes to underlying chronic post-traumatic stress disorder and a desire to change how one feels. Concurrent psychiatric disorders, so-called dual diagnosis, or the modern term co-occurring disorders, are very, very common. And these include depression, bipolar, post-traumatic stress disorder, anxiety, ADHD, and then occasionally we also pick up evidence of psychosis. I think what you need to understand is that drug addicts and alcoholics, they don't drink alcohol or do drugs so that they can crash cars, go to jail, lose relationships, or go broke. They do it so that they can change how they feel. And the target organ for changing how you feel is, of course, the brain. The brain, for the purposes of our discussion, is going to be divided into 3 major areas. There is the reptilian complex down in the pons and the medulla. This is a real primitive area of the brain. This area tells your heart how often to beat, tells you when to breathe, etc. Above this is the emotional brain, also known as the mesolimbic system. This is where the disease of alcoholism and addiction resides, within the emotional brain. Above the emotional brain is the cortical brain. And it's the cortical brain that we think of when we think of other people, because that's where your ability to do math, language, moralize, philosophize, judge, criticize, your so-called willpower, that's up in your cortical brain. But the disease of alcoholism or drug addiction is not in the cortical brain. It's down in the emotional brain. Why do we have an emotional brain? We have an emotional brain because certain activities in life, like food, sex, exercise, drinking water when you're thirsty, when you do those activities, you release so-called pleasure chemicals within the emotional brain that tell you at an emotional, irrational, nonverbal level, keep doing this. It's essential to your survival. Notice how I said essential, not optional. Drugs of abuse like alcohol, cocaine, heroin, methamphetamine, pot, etc. All of those drugs strongly, consistently, and reliably result in the release of these so-called pleasure chemicals. And in the addict, they confuse that with a necessity to survive, because the addict brain is intrinsically different than the so-called normal brain. The addict brain has an on switch, but it doesn't have an off switch, okay? I'm going to use the example of alcoholism because I think that's most relevant for everyone in the rooms this morning. Everybody has probably had a drink of alcohol at one time or another. The difference between an alcoholic and a normal temperate drinker is that in the setting of normal temperate drinking, the phenomenon of craving never occurs. But in an alcoholic, if he takes a drink, it trips a switch in his brain and he craves more alcohol. Hence the saying in AA that one drink is too many and 1,000 is not enough. Why is it that willpower doesn't work in quitting alcohol or other drugs of abuse? Willpower doesn't work because it's a cortical function. The brain is hierarchical in nature. The more primitive the area of the brain, the more power it has. So the reptilian complex can override the emotional brain, and the emotional brain can and does override the cortical brain. What does this look like in normal life? Well, when my youngest son, Kevin, was 8 years old, he went trick-or-treating. On November 1st, he's got a huge sack of candy. He's eating the candy, eating the candy, eating the candy. Finally, I said, "Hey, Kevin, you are going to get sick." And I took the candy away from him. What happened? He had an emotional reaction. He got angry. It percolated up to the cortex, and the plan came out as follows. "Daddy, if you don't give me that candy, I'm going to hold my breath until I die." So what do you think I told him? Go ahead. Because I knew that the reptilian complex would override his angry response. It would override his well-articulated plan, and he would breathe again. This is the dilemma that the alcoholic or addict finds themselves in. They have a hijacked emotional brain. Their brain has been hijacked by alcohol or other mood-altering substances. The only thing that's ever been discovered with respect to alcoholism that reliably results in recovery, one 24-hour period at a time, is a spiritual awakening. How does that work? I don't know. If I knew, I would have a Nobel Prize and I wouldn't be sitting here. But somehow or another, that spiritual awakening displaces the obsession and compulsion to drink alcohol or to use drugs. Let's take a closer look now at the septal nuclei, the pleasure centers that we're trying to stimulate with alcohol and drugs. Notice that in the ventral tegmental area, it's mainly about downers. So alcohol, barbiturates, benzodiazepines. And in the nucleus accumbens, it's mainly about uppers, amphetamines, cocaine, PCP. But notice that there is one drug that stimulates both of the septal nuclei, and that's opioids. Opioids is one of only 2 drugs that stimulate both septal nuclei. The other drug that does that is pot. Now, no one's ever died from an overdose of pot alone, and there's no real withdrawal syndrome associated with pot, at least not one you can get paid for. But there is definitely a lot of death related to overdose of opioids, as we have seen in the recent past, and opioids have a horrible withdrawal syndrome. Opioid withdrawal will not kill you, it'll just make you wish you were dead. You know, the whole idea behind Alcoholics Anonymous and the 12 steps is to give you a psychic defense against the first drink. That's the whole idea. And in Alcoholics Anonymous, they will tell you that if you get run over by a train, it wasn't the caboose that killed you. It was the engine of the first drink. The first drink is what flips the switch. So it's the first drink, the first toke, the first hit, the first injection, whatever it is, that's the one that starts the whole cycle of craving, withdrawal, relapse, craving, withdrawal, relapse, etc. How do we recognize alcoholism or addiction in the physician population? Well, first of all, we should start with the general population. And I'll give you an overview of that. So in America, 85% of people drink alcohol. Of the 85% that drink alcohol, 15% of men drink in an alcohol-dependent fashion, and 10% of women drink in an alcohol-dependent fashion. Of the alcohol-dependent population, 30% have a spontaneous remission in the community and never come to treatment. Of the remaining 70%, only 10% of those go to treatment. Of those who go to treatment, 50% are gone from AA in 3 months, and they go on to insanity, incarceration, or death. And the balance, the other 50%, get sober if they're willing to do a few simple things. But as Dr. Spire said earlier, simple, but not easy, all right? At any rate, the other thing to know is that 50% of alcoholics in our population right now are in their 20s. You will not see them in treatment until they are in their 40s or early 50s, after they have lost their freedom, wound up in jail, their finances, their spouse, and their dignity. How do we define alcoholism or drug addiction? It's very simple. It's your use of alcohol or drugs intersects with trouble. And trouble comes in one of 6 areas: romance, finance, health, family, work, or the legal system. If you're drinking or drugging comes into, if you're drinking or drugging, if you're drinking or drugging causes problems in any of those areas, guess what? You're an addict or an alcoholic. You've got a problem. Addiction typically progresses through 3 phases: Phase 1, fun. Phase 2, fun with some problems. And then phase 3, just problems. When do I get them? Either in stage 2, but most definitely in stage 3. And just as there are symptoms of the disease of pneumonia, which for instance are chest pain, cough, fever, and shortness of breath, the symptoms of active addiction are lying, cheating, stealing, manipulating, and committing criminal acts to get the money to do the drugs. So obviously, these patients tend to be doctors' least favorite patient. I think the thing to understand, though, is that there is a difference between an active addict or alcoholic and a recovering addict or alcoholic, and that while the stigma may be earned for those who are active in their disease, sometimes applying that stigma to people who are actually in recovery is demeaning and humiliating to them. What's the prevalence of drug addiction and alcoholism in the physician community? Well, it's estimated that 6% of physicians are addicts and 14% are alcoholics. And listed below are some of the common signs and symptoms associated with a practicing addict or alcoholic who is a physician. Now, something that I want to mention to you, and I think this is very, very important, is that by the time these symptoms manifest in their career, they are very, very far advanced in their disease, and intervention is required because typically the last thing to go in an addict physician or an alcoholic physician is their work life, because after all, that's where they get the money to do the drugs and alcohol, and it's also something that they are highly invested in and have worked so hard to be able to do. But the symptoms really start earlier in their home life. So they tend to withdraw from family, friends, and community. They may have DWI or other legal issues like public intoxication. Although nowadays when a physician gets a DWI, that's going to land them in front of the Physician's Health Program or in front of the Physician's Health and Rehabilitation Committee, which Dr. Sayers chairs. And they also have a tendency to have increase in accidents, increase in medical problems or visits to the doctor. They may be manifesting increased aggression, agitation, or conflict. They may be having financial difficulties, obviously marital problems, deterioration of their personal hygiene, and then depression, anxiety, and mood instability. Typically, the symptoms that they show in the workplace are that they're late to appointments, they have increased absences, they round at unusual times. If you have a physician rounding in your hospital at 3 o'clock in the morning or very late in the evening, they may be doing that so that they can conceal their alcoholism or drug addiction. They usually have an increase in patient complaints. There may be increased secrecy. They may have an erratic job history. They have a decrease in the quality of care. They make careless decisions from time to time. Their charting has been incorrect. They may show decreased productivity, increased irritability, increased conflict with colleagues. By the time you smell alcohol on somebody's breath in the workplace, they need to go to treatment. Remember, I can't emphasize this enough. In physicians, work is the last thing to go. By the time symptoms of addiction manifest themselves in the workplace, the disease of addiction is very far advanced. It's not going to get better with a heart-to-heart talk. And intervention will be necessary because the obsession and compulsion will overwhelm the patient. Something you need to understand is that the Physicians' Health and Rehabilitation Committee is an advocacy committee, and we work in cooperation with the Physicians' Health Program. And the Physicians' Health Program is an arm of the Texas State Medical Board. So if a physician self-reports, then they will be treated as an individual with a disease, and they will be sent to inpatient treatment, and they're not going to lose their license or have other punitive problems. You know, if you are running a large group practice or a small group practice, and you are seeing these telltale signs in a physician, and that person declines to report themselves to PHP, at that point, if you are concerned about Big Brother, you need to go and find a payphone, because you know what's going to happen if you don't intervene. This guy is going to go on to insanity, incarceration, or death. And in the meantime, he's like a loose cannon that is going to sink the ship of your small group practice or your large group practice. And you will find yourself in a malpractice suit from hell. Because if you have someone who's impaired that's working for you and you didn't do anything about it, you are in deep trouble. So, regulatory issues. I think this quote from Hamlet is very pertinent. This is King Claudius reflecting on Hamlet. It shall be so. Madness in great ones must not unwatched go. Alcoholism and drug addiction is a form of insanity. And, you know, the fact that it is as prevalent as it is in our community has to tell you that it's something to be concerned about. At any rate, physician health programs began in the early 70s. And as I mentioned before, self-reporting is the easier, softer way. It avoids sanctions by the medical board. PHP monitors meeting attendance and does random drug screens, and abstinence-based treatments are really the only treatments that are allowed. Now, if Dr. McQueen is watching this morning, I want to thank her for sending me the handout on medication-assisted treatment. Basically what they say is that, you know, medication-assisted treatment can be employed, but, you know, the amount of work and time and monitoring and energy that goes into that would effectively eliminate it for most people. So I think that while it is theoretically possible, a lot of things are theoretically possible, but if you're in practice, you know what's really possible. Abstinence-based treatments are really the only treatments allowed for physicians. Ongoing in-person monitoring occurs at the Physicians' Health and Rehabilitation Committee meeting for each county medical society here in Texas. As I mentioned before, addiction medicine is really the intersection of science and spirituality. Treatment of the affected physician involves 12-step recovery combined with diagnosis and treatment of concurrent psychiatric conditions. A detailed discussion of the treatment of concurrent psychiatric conditions is beyond the scope of this talk. Medication-assisted treatment, that is the use of methadone or Suboxone, is allowed. This is a typo. Is allowed by the Texas Medical Board, but as I said earlier, the level of monitoring that's required would be prohibitive. I myself manage about 6 physicians right now with this problem, and none of them, whether they were opioid dependent or not, are taking any kind of so-called self-reinforcing drug. So concurrent psychiatric conditions like ADHD, anxiety, opioid dependence, etc., you're not going to see those being managed with amphetamines, benzodiazepines, or Suboxone or methadone. The gold standard for physician treatment really is 12-step recovery. And as I said, the goal of 12-step recovery is a psychic defense against the first drink or drug by means of a spiritual awakening. Pain is the admission ticket to AA. Nobody comes into AA on a winning streak. Nobody wakes up on a Saturday morning and says to themselves, gee, I don't have anything better to do. I guess I'll go down to AA and see what they're up to. AA is usually the last house on the block, and by the time people get there, they have trouble involving one or more of the following: romance, finance, health, family, work, or the legal system. Oh joy. Oops, I don't know what I did there. Hang on. Well, I'll try that again. Okay, bear with me. It's been a really trying morning. Well, let's see. Okay, so we're going to go with progress and not perfection. And if you can't see this all that well, don't worry, I'll read it to you. At any rate, beginning the recovery process, following inpatient treatment of 1 to 3 months duration, the physician returns home having executed a contract for monitoring with PHP. Entry into AA is the same for everyone. You get a sponsor, you read the first 164 pages of the big book of Alcoholics Anonymous, you do 90 meetings in 90 days, you hit your knees in the morning and you ask the God or the higher power of your understanding to keep you sober. And if you stayed sober, you thank that God at night, and you don't drink or use mood-altering substances between meetings. So I want to take a moment now to talk a little bit about what is a sponsor. Well, first of all, a sponsor is someone who has worked all 12 steps of the recovery program and has at least 12 months of sobriety. And they are going to act as a guide to take you through the recovery process. And the sponsor is not a nurse. It's not a banker. This is someone that is, oh my goodness, what's happening to my slides here? Okay. So a sponsor is not someone who is a nurse or a banker. They're just a guide to 12-step recovery. Typically, when I recommend to a patient to get a sponsor, I talk to them about coaching, okay? So I say, look, you know, so say you were going to play football and you were going to you were going to go ahead and sign up for flag football in your neighborhood, and you had your choice of two coaches. Some kid who just graduated from university with a degree in kinesiology, or Mac Brown. Which one would you pick? Well, I hope you pick Mac Brown, because Mac Brown's seen everything that come down the line. And that's what you want in a sponsor. People who come into the program and say that they want a sponsor they can relate to, that's largely BS, okay? You need an old guy that has been around the block, who knows a few things, okay? He's seen all the different plays over time. The other thing is, read the first 164 pages of the Big Book of Alcoholics Anonymous. The Big Book of Alcoholics Anonymous was written in 1935. In 35, Bill Wilson and Bob Smith got together, two alcoholics, and Wilson is the one who drafted the Big Book. He was a incredibly bright, highly alcoholic who was a stockbroker, extremely successful until he wasn't. He, in combination with a colon and rectal surgeon from Akron, Ohio, came up with the Big Book of Alcoholics Anonymous, which was published in 1939. And the first 164 pages of the Big Book of Alcoholics Anonymous has not changed one word, one comma, since it was written in 1939. Now, to me, that means two things. Number one, it's classic knowledge, also known as wisdom, about the disease of alcoholism, and for my money, drug addiction also. And it means that it works, okay? Because the law in life is, if it works, don't fix it. The book's been through 4 editions. The editors never thought it necessary to go back and change anything about the first 164 pages of the Big Book of Alcoholics Anonymous. So that's the outline of the program of recovery in the first 164 pages. You want to do 90 meetings in 90 days. Why do you want to do that? Because when you are changing a behavior, you have to do the new behavior consistently. All right. Also, you know, the situation with hitting your knees in the morning and asking the God of your understanding to keep you sober, and if you stayed sober, thank him at night. This is a tough one because 50% of the original membership of Alcoholics Anonymous was atheist or agnostic. Turns out, though, that atheism or agnosticism is not a contraindication to a referral to a 12-step program. Turns out that people who are highly educated in religion actually have a worse time in 12-step program than do agnostics or atheists, because the highly educated ones, they already have what I call, you know, God in a box. They already know what God is. They don't have, but the atheist or the agnostic has to arrive at that for themselves. So sometimes what I will tell patients is, well, God is G-O-D, which is gift of desperation. So the fact that you were desperate is what brought you into the program, okay? And that now you are going to go to G-O-D, or group of drunks or group of druggies, from which you are going to get G-O-D, good orderly direction, or the next right thing, okay? And you know, the idea in 12-step recovery is that you get to come up with your own conception of this higher power, okay? That you do not have to believe in any kind of miracles. 12-step recovery does not require that you believe that someone can walk on water, change water into wine, or come back from death. Your higher power is whatever makes sense to you and works for you. Now, some people will say that their higher power is a doorknob, and I don't get that. But, you know, whatever. I mean, if they're sober, okay. The other thing I wanted to say about doing 90 meetings in 90 days, besides practicing a new habit, is that the crux of the matter in 12-step recovery is that you cannot think yourself into right action. You must act yourself into right thinking. This is a program of action. It is not a program of thoughts or feelings. I don't care about your thoughts or feelings. I want to know what you're doing. And then you don't drink or use mood-altering substances between meetings. But you know what? When you do drink or use mood-altering substances and you come back to AA, do you know what they'll say to you? Welcome back. We're glad to have you. They are glad to have you because they know that they've all quit 1,000 times before. So they're down with that. Okay, I'm going to try next slide. Are you in control or am I? Oh, you're in control. See, there is a higher power. See? Okay, so the goal of AA is step 12. Having had a spiritual awakening as a result of these steps, we try to carry this message to alcoholics and to practice these principles in all our affairs. So what is meant by a spiritual awakening? Well, I used to think that a spiritual awakening had to do with me going to Nepal, finding some monk to climb a mountain with and sit up on the mountain and meditate, and that would be my spiritual awakening. That is not a spiritual awakening. A spiritual awakening is merely a change in one's attitude toward the current situations and circumstances of our lives. So in essence, a spiritual awakening is an attitude adjustment. Does that sound familiar? Sounds like attitude adjustment or happy hour, doesn't it? Yeah, of course it does. Because that's what being alcoholic or drug addict is all about. When you talk to enough addicts or alcoholics, what you will find out is that from a very early age, they feel like there's something intrinsically defective about them and they cannot put their finger on it. And they're like a jigsaw puzzle with a couple of pieces missing. And they're out there in the universe bumping around with this Brownian motion going on until they bump into that drink or drug, and those puzzle pieces are plugged in and they are good to go. And brother, they are going to run with that until they hit the wall, and then hit the wall again, and hit the wall again. That's just the way it works. But what they need is a substitute for the drugs and alcohol, because at some point the drugs and alcohol quit working, and then they need a substitute. And so that's really what the program of Alcoholics Anonymous is designed to do. Is it's the substitution of spiritual connection instead of tuning out with drugs and alcohol. Okay, next slide. So the 12 steps can arbitrarily be divided into 4 major areas, and these are based on first century Christian principles. And Bill Wilson picked these up when he was studying with a sort of evangelistic fundamentalist group known as the Oxford Group. And they were looking at first century Christianity, and they came up with these 4 things: complete and total reliance on a higher power or God as you understand God, confession, restitution, and then passing it on. Next slide. Step 1, we admitted we were powerless over alcohol, that our lives had become unmanageable. Taking this step is a tacit admission that alcohol is a malignant power greater than yourself. Once you take that drink, it trips a switch in your brain and it's all over. You just got hit by the train. It was the engine that killed you, not the caboose. Craving for alcohol is triggered by the first drink, and that's a direct manifestation of the malignant power of alcohol. And, you know, when I'm working with people, I will ask them 2 questions on the first step. When drinking, do you know when you'll stop or where you'll end up? That's an index of powerlessness. And also, what have you lost through drinking? That is an index of unmanageability. Next slide. Step 2, came to believe that a power greater than ourselves could restore us to sanity. This amounts to accepting the proposition that a benign and loving higher power could displace the malignant and corrosive higher power of drugs and alcohol. And since nature abhors a vacuum, it is a program of substitution. So the thing that I would emphasize to you in the second step is that people who are sane do not need to be restored to sanity, okay? People who are drinking alcoholically are insane. And, you know, came to believe that a power greater than ourselves could restore us to sanity is just accepting the idea that if a malignant higher power can do that to you, then perhaps a benign higher power can do it. The higher power concept in America today is very difficult to get across to patients because we are effectively a secular society, science-based, and you know, the God of our fathers is viewed as, you know, sort of irrational fairy tale type belief, and you know, it's a little bit like, you know, trying to well, it's difficult to convey the concept, but I would use the following example. If I'm working on a 12-story building and I fall off the side of the building, I'm going down, okay? That's the higher power of gravity. Gravity is a neutral higher power, okay? And so it doesn't matter how smart or stupid, how moral or immoral, how rich or poor you are. If you step off the side of that 12-story building, you're going down. The Houston police are a higher power, okay? If you see that bubble machine in your rear view mirror, you better pull over. And when you pull over, you better know that you're in the hands of a higher power. Now, they may be benign and, you know, just give you a warning, or they may be malignant and handcuff you and beat you up and throw you in the bayou, which they have done. So, you know, higher powers, there's a lot of different kinds of higher powers out there, but the idea is you've got to come to believe that something other than yourself can displace the higher power of drugs and alcohol. Next slide. So, you know, Dan, the fighter pilot, used to attend Hilltoppers meeting, and he would say that fear is I may not get my way, anger is I'm not getting my way, resentment is I didn't get my way, and remorse is, oh no, I got my way. Well, getting into recovery is really no longer about getting your way. It's about aligning your will with the will of your higher power. You do the legwork and the outcome, and you leave the outcomes up to God. And with respect to what was discussed this morning about all of these systems and technology and unreasonable administrators and the criminal industry of health insurance and all of that kind of stuff, I would tell you that from the 12-step perspective, the hula hoop concept really works, okay? So if I'm wearing a hula hoop, I potentially have control over everything inside the hula hoop. Everything outside the hula hoop, no control. As you know, is evident by my presentation today. Had no control over my internet service provider who cut my speed of my connection to 1/3 of what it was yesterday. Why did they do that? Anyway, you know, the deal is that in life, there's 3 kinds of business, okay? And business, when I say business, I mean purposeful activity. So there's 3 kinds of business. There's my business, what goes on inside my hula hoop. And then there's everything outside my hula hoop, which is either not my business or it's God's business, okay? And all that stuff outside your hula hoop is either not your business or it's God's business. The only thing you can do is focus on your hula hoop. Now, of course, if someone tries to jump in your hula hoop, it's a good idea to eject them. So I don't want you to get the idea that, you know, people in recovery are just walking around and we're just doormats. No, Spectrum will hear from me on Monday morning, okay? I mean, let's get real. Okay, so next slide. If we look at the root cause analysis of the toxic emotions that are present since childhood, we see that neurotic fear, from the 12-step perspective, neurotic fear is seen as a toxic manifestation of self. It is both an excess of self-reliance and it's also a form of self-centeredness. In terms of, I didn't understand this at first, you know, about fear being a form of self-centeredness, but actually fear is, I may not get my way, all right? In other words, I'm afraid that I will lose something I already have, or I'm gonna get something that I don't want. And so the focus is all about, you know, it's the opera singer focus. Me, 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 me. You know, everybody wakes up every morning and they warm up with me, 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 what's in it for me, you know, at least if you're addict or alcoholic. And you have to reprogram that, you know, because that doesn't work too well. Anyway, anger is seen in, so fear, anger, resentment, remorse. The 12-step perspective on this is that anger is seen as the dubious luxury of normal men. It has the capacity to send an addict into an emotional bender, and they can spin off and be very ineffective and not present because of their anger. Resentment, however, is the #1 offender. It kills more alcoholics and addicts than anything else. And the alcoholic will typically drink at the person that they resent. Remorse is usually a byproduct of hurting others, and that's usually dealt with later on in the steps. I think the thing that you need to understand is that spiritual development in 12-step recovery is hard work. Let me say that again. Spiritual development in recovery is hard work. Okay, so if you're not into hard work, this may not be a good thing for you. But you cannot go into the future pushing the past ahead of you. In other words, a lot of people's past is A lot of people's future is their barfed up past. Next slide. Okay, step 3, made a decision to turn our will and our lives over to the care of God as we understood God. You know, the problem with the God concept, as I mentioned earlier, has a lot to do with how we were raised as children, both by our parents and in terms of organized religion. So that when I'm working with someone and we're on step 3, I'm dividing step 3 into 3 columns. So in column 1, tell me everything you learned about God as a child. Give me all the characteristics of the God of your understanding. In column 2, tell me all of the characteristics of your parents, because your parents were the first God, the first 2 higher powers that you knew of. And in the 3rd column, I ask them, write a want ad for the God that would work for you. In other words, what's the job description of the God that'll work for you? So typically what I get in the 1st column, if they're Christian, is that God is an old white guy with a long white beard, sits behind a judge's desk. He's got a little abacus. He tallies up your vices and your virtues, and based on your account balance, he kicks you up to heaven or slaps you down to hell. You know, in the meantime, he's like the NSA, and he's spying on you and punishing you here and there for your transgressions. And then he's got, you know, these other characteristics. He's all loving, all forgiving, all powerful, all seeing, etc., etc. Typically, you know, the parents' characteristics are going to be pretty much, you know, there's going to be a lot of individual variation. And so once the patient has a concept of a higher power that makes sense to them, then they can, once they have a concept of a higher power that makes sense to them, then they can, you know, turn their life and their will over to that, and it's simpler. Next slide. Okay, step 4 is made a searching and fearless moral inventory of ourselves. And what we're going to do in that is really, this is where the real hard work of recovery occurs, what I was mentioning earlier. The problem is, this is another example of simple, not easy. What you're going to do in the 4th step is you're going to start from birth, and you're going to go all the way up to the present moment, and you're going to inventory your resentments, your sex conduct that harmed other people, and your fears. And then you're going to sit down with your sponsor in the 5th step and admitted to God, to ourselves, and to another human being the exact nature of our wrongs. And so when you're dealing with your resentments, you will be talking about the person, place, thing, idea, or institution you resent, the cause, what they did to you, how it affected you. Did it affect your personal relationships, your pocketbook, your ambitions, etc.? And then finally, what was your part in it? Because we all have a part in our resentments. Then in the sex conduct, you're going to list everyone that you harmed through your sex conduct. Where did you cause jealousy, envy, who did you harm, etc. And then, next slide, please. And then in the 5th step, your sponsor will hear this confession, And of course, your sponsor must be an honest and trustworthy person who has significant sober time. He's someone who walks the talk and has a sponsor themselves. Basically what's going to happen in this step is that you're going to tell them everything you're ashamed of, everything you're afraid of, and everything that's a secret. Now, you know, what I tell patients is that I advocate the English Channel method for this. You know, if you got to swim the English Channel, you don't want to dip your toe in, okay? That water is really cold. You want to dive in. So dive in with the biggest, baddest thing that you can think of. And then typically your sponsor they'll nod like that, you know, and then they'll say something really disappointing. They'll say, oh yeah, I hear that in 80% of fifth steps. So there's nothing new under the sun. You probably haven't done anything or said anything or that they hadn't heard. But what's the result of that fifth step? Well, the weight of shame, guilt, and anxiety just seems to come off your shoulders. Next slide, please. In about 80% of people, and they just feel like a weight has been lifted. Now the other 20% are just really exhausted. But at this point, you enter into step 6 and 7, which are really the mystical steps. We're entirely ready to have God remove all these defects of character and then humbly ask him to remove our shortcomings. Following, so with those steps, you are no longer striving to correct your character defects by force of will. In other words, you're allowing the higher power to do that correcting. Next step, or slide, please. Steps 8 and 9 involve restitution. This is also a really difficult step. Because you, in step 8, made a list of all persons we had harmed and became willing to make amends to them all. So for most addicts and alcoholics, this is people that you have flim-flammed, that you've stolen money from, that you've treated badly in business, that you've failed to show up, et cetera, et cetera. And step 9, made direct amends wherever possible, except when to do so. So you assemble your step 8 list using your step 4, because everyone that's on your resentment list or on your sexual harms list is going to wind up on your 8th step list. And in step 9, when you go to make your amends, you want to sandwich those amends. So you talk to the sponsor first, and then you do the amends, and then you debrief with the sponsor afterwards. Next slide, please. Steps 10 through 12 are practice it, enhance it, and pass it on. In step 10, continue to take personal inventory, and when we were wrong, promptly admitted it. So I'm gonna take this time to do a little step 10. I'm sorry for shouting earlier. I didn't mean to alarm you. But continue to take personal inventory when we were wrong and promptly admitted it. 11, sought through prayer and meditation to increase our conscious contact with God as we understood God, praying only for knowledge of his will for us and the power to carry that out. And then in step 12, having had a spiritual awakening as a result of these steps, we tried to carry this message to alcoholics and practice these principles in all our affairs. So, you know, the thing is that the steps are written in order for a reason. The reason they're written in order is because that's how the spiritual experience comes about. You can't skip any, you got to go in order, you can't skip any of the steps. And, you know, the thing that will cause relapse for a lot of people is that 4th and 5th step, because usually in the first iteration or two of that, they are really uncomfortable sharing the things that they are most ashamed of. So 12 step is a lot like Dentistry, you know, if you go to the dentist with a cavity, they got to drill out the corrupted tooth before they can put in the filling, okay? And in 12-step recovery, if you do a fourth and fifth step and you hang on to some of the things that you are most afraid of and most ashamed of, then the experience will not take. It's like trying to put filling in over dead, corrupted tooth. Next slide. This is the one you're waiting for, the conclusion. Completion of treatment and monitoring results in a very high success rate for physicians, on the order of 85 to 95%. The vast majority of physicians report an enhanced quality of life and express gratitude for their sobriety. The vast majority of physicians also complain bitterly about the monitoring process and its cost, but hey, you can't make an omelet without breaking a few eggs. Next slide. That's my gratitude slide. And so if there are any questions, I'll take those.